And joining us today is Representative Diane Black. Welcome, Congressman.
Thank you. It's great to be here with you.
We're so glad to have you here. And you actually represent Tennessee's 6th district, and that does include part of our East Tennessee here. We've got Cumberland and Fentress counties. Kind of an interesting shape.
Yes,
your district is there. All right, so I wanted to start with health care first because you are a nurse of many decades, and also you are the first female chairman of the House Budget. Those two things have a lot to do with the ACA. So I wanted to know, what do you want to see done with the ACA?
Well, first of all, let's talk about why it is that we even want to do anything with the ACA. We're seeing an implosion, just a self-implosion, and if nothing is done, then we're going to see more and more damage and hurt done to our constituents and constituents across the entire state. And so we see premiums that are rising, deductibles that are rising. More and more people, insurance companies are leaving the health arena, and so 2/3 of our constituents now across the entire state only have one choice, and that's really not a choice. That's a monopoly. And so we want to put something in that's more patient-centered, give them an opportunity to say, here's what I want at a price that I can afford.
Okay, so more privatized, less government-run.
Well, just more options and choices out there.
Okay, cool. And so also you're going to be, as the chairman of the House Budget Committee, you're going to be dealing with quite a large budget and quite a large debt, $20 trillion. So what are your goals in this role?
Our goal is to do everything we can to work toward balance. We want to be able to show the American people that we are understanding that right now our debt and deficit spending is not going to help future generations. It doesn't help us today. And so we're looking at every single penny that's in the federal budget and making sure that we're saying that that dollar is worth spending and it is worth the taxpayer dollars spending money on it.
Right. So we know, I've heard from a lot of constituents that are using the Affordable Care Act, that are on the exchange, that are worried that they're going to be left behind when we do change over. What do you tell those folks?
I want to tell them that they do not need to worry because we are going to make sure they don't fall off the cliff. I was here in the state of Tennessee in the House General Assembly, actually in the Senate, when I worked with the then Governor Bredesen, the Democrat governor, to dissolve TennCare and to put something in place that did help to shore up, especially those that have pre-existing conditions. But I want people to know that we're not going to let them fall off the cliff, that we're going to have a glide path to make sure that they have good, affordable care available to them.
Okay. Well, our new president has made a lot of waves in just 1 month in office, specifically yesterday with his direction to the immigration enforcement agencies to more aggressively round up illegal immigrants. What did you think about that direction? Well,
I think that the President Trump, is doing exactly what he said he was going to do, and the American people elected him because they liked his message. Look, security is the most important thing that we can do. By the Constitution, it is our #1 role. And he is providing that certainty for people that he is going to do what he said he was going to do when he was elected, and that's to make sure that our borders are safe and that our country, when people come to our country, they come here legally in the right way.
We appreciate you so much, Congressman Diane Black, for coming in and speaking with us today.
Thank you.
All right. Well, soon.